Talking about the imaging of the vertebral column, there are some clinical manifestations we should discuss, even though there are actually a lot, but we are not going into the pathologies and we are talking about the normal anatomy in terms of its appearance on imaging and radiographs. And neck pain usually has uh, the normal not pain, but there may be some manifestations, and we're not talking about the fractures, etc. But neck pain is important to consider because it is a very common condition in the general population, and we get to see a lot of patients with that. And in this lecture, we're going to talk about a little bit about neck pain and the radiograph and X-ray imaging in neck pain, MRI and CT, which is known as computerized tomography, and magnetic resonance imaging in neck pain as well. So talking about neck pain, so neck pain, here we are talking about non-traumatic neck pain, and it is very common. And according to a study published in 2018 in the Journal of Pakistan Medical Association by Osama et al., it was mentioned that neck discomfort is the most common, and neck is the most common site of musculoskeletal symptoms. And because of that, the buildup of discomfort leads to neck pain. And because the discomfort is the most common in neck, similarly, neck pain is actually the most common musculoskeletal site for the occurrence of pain. And it can be because of musculoligamental strain, injury, or awkward posture, or poor mechanics, or anything of that sort, which may involve ligaments, disc, joints, bones, or muscles and tendons, any of these musculoskeletal structures. And literature suggests that 70% of these episodes resolve within 1 month, and the remaining 30% resolve over a longer term. However, a small minority have chronic neck problems and they require prompt management. Now, talking about the neck pain, there are, as I already mentioned, there are several structures which are capable of producing pain in the neck region. They involve the vertebral bodies, and such as, for example, in cases of osteoporosis, and or you can say the degeneration or osteoarthritis, in which the vertebral bodies or the intervertebral joints become degenerated, and they can actually result in increased joint reaction force and uh, production of pain and symptoms. And ligaments, and for example, there can be increased laxity due to a whiplash injury or a trauma, or even because of an awkward posture, prolonged awkward posture, and working habits, etc. Muscles are very common, and they can involve both the active tone and the passive tone components of the muscle can be responsible for neck pain, and they can even result in tensional headaches. And uh, these muscles, when involved, they actually go into spasm or hypertonicity, and they can result in the formation of trigger points or even increased muscle tone, which results in the approximation of joint surfaces, resulting in increased joint reaction force, and thus involving the joints as well, resulting in facet joint inflammation, for example. And then intervertebral disc, talking about the lumbar spine, intervertebral disc are more commonly involved in the lumbar spine, but they're also involved in the cervical spine, and they can actually result in disc herniation, disc prolapse, or disc bulge, and that can actually involve the spinal nerve roots which are exiting from those structures and cause cervical radiculopathy, for example. And they can involve and cause symptoms in the median nerve, radial nerve, and ulnar nerve, and that also requires medical and physical therapeutic management for that. And then it can also involve joints such as facet joints, which are very commonly involved, and they actually lead to inflammation of the facet joints, and those inflammation of the facet joints can then extend the inflammation to the nerves, which can result in the symptoms of radiculopathy, or inflammation of these segments can actually lead to the narrowing of the foramina for the exiting of the nerve roots and causing compression on them. Similarly, inflammation of these intervertebral or specifically facet joints can result in irritation of the muscles and result in increased tone of the muscles, and that increased tone of the muscles can cause further approximation of the facet joints, and thus a vicious cycle begins, and that needs to be broken up by physical or biomechanical correction treatment. And it can also involve vascular and neurostructures. Neurostructure is already mentioned in terms of radiculopathy and cervical radiculopathy, and in terms of vascular structures as well, such as the vertebral basilar artery, which is going through the foramen transversarium in the cervical spine, and narrowing of that or involvement of that can even cause symptoms such as vertigo, nausea, dizziness, and that is very important to be dealt with as well. And because that also results in the formation of the blood supply for the structures of the brain, and thus it is very important as well. And talking about the referred zone of the neck pain, so pain is referred from neck to the shoulder, but the pain from the can also be referred to and from shoulder, heart, diaphragm, mandible, and temporomandibular joints. So pain from the neck can actually refer to these areas, and pain or problem from these areas can also be referred as pain in the neck. So it is very important to observe that. And pain from a neck can also be referred to the shoulder blades, which is the medial aspect of the scapula, as well as can also be referred to the head in terms of cervicogenic headaches, and which are very common, and they can only be treated by treating the cervical spine instead of giving medicine for headache, which would not actually cause that much benefit. Now, talking about the imaging of the patient with neck pain, so where symptoms are severe and persistent, we should go for a radiograph or an imaging scan. But other than that, if it is not so, it is not much required, because it self-resolves in 70% of the cases. And moreover, other relevant factors or history or examination, such as trauma or known primary tumor, actually makes it very important to necessarily go for an imaging report. And this here is actually imaging of a patient with neck pain, and in this we can actually look for different structures such as the intervertebral joints, the facet joints, the the vertebral bodies, the articular pillar, the spinous process. We can actually look for all of them, and you can also look at the biomechanical components such as the posterior longitudinal angle and the craniovertebral angle for in terms of the straightening of the cervical spine or the cervical lordosis. We can also look at an AP view to determine if there is actually a lateral listing of the spine, or if there is a scoliotic curve in terms of the biomechanical analysis, and if there is rotation of the segments. So all of those things are very important if you are looking at a biomechanical perspective for the findings that you want to look for the patients in neck pain on an X-ray. In terms of other options for imaging of the patient with neck pain, we can also go for a magnetic resonance imaging scan or a computerized tomographic scan, depending on the need. So MRI is something that we can go for when further imaging is required in terms of persistent nerve root pain, because MRI can actually visualize the soft tissue structures in a much better way, such as the nerve roots as well as the spinal cord. So if there is persistent nerve root pain, or we are suspecting radiculopathy or myelopathy or cervical strings, for example, we can actually go for a magnetic resonance imaging scan. And similarly, assessment of a possible spinal cord abnormality is already mentioned in terms of a cervical strings, or also known as cervical syringomyelia. We can go for that as well. Moreover, if we are suspecting that the problem is in the bone and we need a finer detail in terms of the bony anatomy, so we should go for a computerized tomography scan. And for that, we actually go for assessing of, for example, if we are suspecting a vertebral body tumor. So here we actually have two examples. Now this one is actually a magnetic resonance imaging scan, and as you can see, it much better visualizes the soft tissue structures. For example, if we take a look at the discs, so we can even actually visualize which one of the discs are hydrated and which are not. We can actually look at the spinal cord as well, and these structures are very good, better visible here. We cannot actually look for a cervical strings in a patient with a radiograph or an X-ray. Similarly, we cannot look for cervical strings or cervical syringomyelia in a patient which has only a CT scan. So here we can see once again, in a computerized tomography scan, the major focus is on the bony structures, and here we can see the bones are much better visible as compared to an X-ray. And if there is even a slightest hint of the suspicion that we are having a tumor in a patient, for example, a bony tumor in vertebral body, so we can actually look for this computerized tomography scan, and that can actually give us a better overview and information about it. So that's pretty much about neck pain and how actually that correlates with the radiographic or imaging. And I hope you learned something new out of it, and keep on watching sqadia.com for more lectures like this. Thank you very much.